Has someone you love started showing subtle but concerning changes over the past year? Many people believe that death in old age happens suddenly, but the truth is, the body often gives quiet warnings months or even a year in advance. The problem? These signs are easy to miss. They seem small at first. Only when we look back do we realize the clues were there all along, and by then, it's often too late to prepare, too late to make those final memories truly count. In this video, we'll explore 5 key signs that often appear in the final year of life for many elderly people. Some may seem like normal aging, others may feel minor, but they often reveal something deeper, the body gradually winding down. Recognizing these signs early can help you provide better care, create meaningful moments, and most importantly, bring comfort, dignity, and peace in your loved one's final chapter. Stay with us until the end. These insights might help you prepare, emotionally and practically, for what's ahead. When you understand the signs, you're not caught off guard. You're empowered to cherish what truly matters. 1. Significant weight loss. One of the first and clearest signs is unintentional weight loss. It might begin subtly, a belt that suddenly feels loose, clothes that don't fit the same, or a fading appetite. Families often brush it off as normal aging, but losing weight without trying is rarely a good sign. It can mean the body isn't absorbing nutrients well anymore. Muscle mass begins to decline. Digestion and metabolism slow down. Even when meals are eaten, the body may not be processing protein or energy properly. This leads to more than just weight loss. It brings fatigue, weakness, a higher risk of falls, and vulnerability to infections. In many cases, a fading appetite also plays a role. Seniors might not feel hunger the way they once did. Food may lose its taste. They might skip meals or eat very little, not from choice, but because their body is slowly shutting down. Underlying conditions like heart failure, cancer, or kidney disease may also be quietly progressing. Even depression or memory decline can cause a loss of appetite. Families often try to help by offering favorite meals or nutrition drinks, but when weight keeps falling, it's a deeper issue. Rather than forcing food, the focus should shift to comfort, soft, easy meals and hydration, and preserving dignity. If your loved one is eating less, feeling weaker, and losing weight despite your efforts, it's time to pay attention. It's not just about appearance, it's the body sending a signal. 2. Extreme fatigue and weakness. Another powerful sign is deep, ongoing fatigue, the kind that rest doesn't fix. We're not talking about normal tiredness. This is exhaustion that makes even small tasks feel overwhelming. Getting out of bed becomes hard. Walking across the room feels like a chore. Activities they once enjoyed become too much. This happens because the body is conserving energy. As organs slow down, the body shifts into preservation mode. Blood doesn't circulate as well. Muscles don't get enough oxygen. The result? Constant weakness and unsteadiness. They may sleep more, nap during the day, or suddenly seem drained even after resting. And emotionally, this fatigue can be devastating. Once independent people may withdraw, feeling embarrassed that they can't do what they used to. Families sometimes misunderstand this as laziness or giving up, but forcing activity doesn't help. What they need most now is gentleness, patience, and comfort. If your loved one is sleeping more, doing less, and seems deeply tired all the time, it's not just aging. It may be the body preparing for its final transition. 3. Cognitive confusion and emotional withdrawal. Changes in memory, communication, and emotional engagement are also common, often months before death. You might notice someone who was once sharp becoming forgetful. They may struggle to follow conversations or feel lost in familiar places. These aren't just senior moments. As circulation to the brain decreases, cognitive function begins to fade. They might forget names, repeat themselves, or lose track of time. Sometimes they're clear one moment and confused the next. Emotionally, they may withdraw, not because they don't care, but because even conversations can feel exhausting. Crowded rooms or loud voices may overwhelm them. They may speak less, sit in silence, or seem emotionally flat. Some may become irritable, others unusually calm. This is the brain adjusting to the body's changes. Their responses shift. But even if they stop reacting the way they used to, they can still feel your presence. Rather than trying to pull them back, meet them where they are. Sit with them. Speak gently. Reassure them. Because even if words fade, your love and presence still matter deeply. 4. Frequent infections and slow healing. As the immune system weakens, another red flag appears. Frequent illness and slow recovery. A person who rarely got sick might now catch every cold, every flu. Minor infections, like UTIs, pneumonia, or skin sores, become common. Cuts and bruises take longer to heal. This happens because the body's defenses are fading. Even antibiotics may not work as well anymore. You may also notice chronic wounds, scratches or sores that won't close or keep reopening. Poor circulation prevents oxygen and nutrients from reaching the skin, slowing down healing. Sometimes the only sign of infection is sudden confusion, extreme tiredness, or a loss of appetite, not the classic fever or pain. In these moments, families often push for more treatment. But at a certain point, the goal shifts from curing to comforting. Cleanliness, hydration, and soft care can make more difference than another hospital stay. If your loved one is facing repeat infections or healing slowly, it may be a sign that their body is nearing the final stage. 5. Changes in breathing and circulation. Lastly, one of the clearest signs that the end is near is noticeable changes in breathing and circulation. You may notice slower, shallower breaths or sudden pauses between them. Breathing might become irregular, fast, then slow, sometimes with long gaps. This is especially true with something called Cheney-Stokes respiration, a pattern where breaths alternate between deep and rapid to slow and shallow, with pauses in between. Circulation also changes. Hands, feet, and even the nose or ears might feel cold or look bluish or mottled. This happens because the heart is conserving energy and reducing blood flow to the extremities. These changes can be unsettling to witness, but they're part of the natural process. When breathing shifts or limbs grow cold, it's often the body's final message that it's letting go. If you've noticed any of these 5 signs in someone you love, know this: you're not alone, and what you're seeing is not just aging. The body has its own quiet language in the final chapter of life, and by listening closely, you can bring comfort, presence, and love to those last precious moments. If this video helped you in any way, let me know by commenting below. And if you'd like to see more videos like this, be sure to subscribe and turn on notifications. Your support helps us keep sharing important, heartfelt stories and guidance. Thank you for watching, and take care of yourself and those you love.